Hello, good evening. I'm Dr. Janice Morrow with American Mood Swings, and tonight we have Dr. Fareed Banimad from the American Addiction Institute of Mind Medicine here in Irvine, California. So he is an addiction specialist and he has a background in ER medicine, and we're very grateful that he's here tonight. Let's talk about now how somebody calls you up. Hey, I want to quit opiates. I'm strung out. I need to quit. And they come into your office, and let's go from there. How are you going to determine the course of action, and what is treatment involved? And let's go into like the acute withdrawal, chronic withdrawal, and the different medicines and that kind of thing.
Are you talking strictly opiate? Someone calls for opiates, or how approach to a substance abuse patient? It's up to you.
No, let's have you a substance abuse, because you did mention, and like you said, most people coming in now, it's polysubstance. Polysubstance. Yeah. They're on coke, or stimulant, and a opioid. So let's see how you approach that. How you would tackle that.
I'm going to try to give you a kind of a general. All-encompassing answer, because I should be able to do that because our practice is so individualized. But in general, the way it is done is there's levels of treatment for depending the intensity and frequency of your use and abuse. You know, someone's regularly using heroin, it's called, within the clinical criteria, detox. You go into a detox. Then there's a step down to what's called a partial hospitalization, then intensive outpatient treatment, and out treatment for the most part. And I'm not going to comment on that's wrong or right, but the numbers aren't happening. You don't have to necessarily go by that criteria because not only does it not work, but not everybody needs that intensity of care, which doesn't work anyway, right? What they need, you have to look at the individual, you have to look at their resources, and you have to look at where they're at in their desire to come in and see you. That's before you even evaluate the substances. Who are you? Why are you coming in here? What resources do you have to stop? And that's an important question in a society like ours. That's how the political economy is set up. People have to have insurance pay for. Okay. After I realized that, so for example, if my girlfriend's going to leave me unless if I go quit heroin, you're a very different patient than someone who has just gotten out of jail for the 7th time, has abscesses, HIV, hepatitis C, and is 10 years older than that first patient. Nevertheless, the way we approach it is everybody should come in, right? And we don't care if you're using or not using. 2, you're going to see people and you eventually start to tease out that, look, everyone's using everything at the same time, right? I don't even know what somebody like that would go into a detox for, because they don't know what to do. What are they going to do? Ask the insurance for 4 days of heroin, 4 days of alcohol, 4 days of coke? No, the way we do it is really simple. We're a medical office. They come in. You're doing meth. You're doing benzodiazepines. You're doing fentanyl that you're buying on the street. We look at you where you're at. We give our treatment recommendation. We are a full advocate of medication-assisted treatment for most people, because the data tells us that will get you to where you need to go. And the medication-assisted treatment refers to buprenorphine products, Suboxone products for heroin addiction, opiate addiction. It's one of the few drug addictions that we actually have a medication that works.